In this presentation, we'll go over in more detail how to properly form clinical questions using the PICO format. There are multiple purposes and benefits for having a structured format for asking clinical questions. First and foremost, it creates a consistent structure for forming the strategy and study design. This makes the process consistent across both people and places. It also assures that no element is omitted by assisting the nurse in clarifying what he or she desires to know. By limiting the question to the key components, it increases the probability of finding the most appropriate evidence in the shortest possible time frame. There are two basic types of questions: background questions and foreground questions. Background questions are the most basic and wide-ranging. They ask for general information about a clinical issue, and for topics where little is known, they must often be answered first in order to form the basis for asking a more detailed, searchable question. They usually have two components: the starting place of the question, which is the what, where, when, why, and how piece, and the outcome of interest of what is desired to be known. They are generally broader in scope than foreground questions. For example, how does lidocaine affect heart rate? Foreground questions, on the other hand, are our PICO formatted questions and ask for specific scientific evidence about diagnosing, treating, or educating patients. For foreground question, the focus is on specific knowledge, and so the use of the PICO format is recommended in order to create the most focused literature search. For example, in elderly cardiac patients, how does lidocaine compare with beta blockers in lowering heart rate? There are 5 basic types of foreground questions. Though their components are the same, they differ in what they are specifically asking. Intervention questions ask what intervention most effectively leads to an outcome. Prognosis or prediction questions ask what indicators are most predictive of an outcome. Diagnosis questions ask what test most accurately diagnoses an outcome. Etiology questions ask to what extent is a factor associated with an outcome, and meaning questions ask how does an experience influence an outcome. The key to asking well-worded questions is to include all of the components needed for an appropriate answer. The most common mnemonic used to remember the components is the PICO approach. In this method, your question should include the population of interest, the intervention, exposure, or issue you want to examine, the group to which you would like to make a comparison, the outcome you want to measure, and the time frame you want to examine. Note that a comparison group and a time frame are optional and are not always used. The next few slides will show you how to use a fill-in-the-blank type template to help make forming PICO questions easier. In each one, you need only determine what type of relationship you are assessing and then fill in your components. For example, an intervention or therapy question is asking about which of multiple types of therapy is leading to the best outcome. So for example, if in type 1 diabetics we wanted to compare aerobic and non-aerobic exercise for their effect on hemoglobin A1C over a 3-month period, we would first need to determine our components. Type 1 diabetics is our population. We are comparing aerobic exercise, our intervention, to non-aerobic exercise, our comparison, on the outcome of hemoglobin A1C over a time frame of 3 months. So our question would be, in type 1 diabetics, how does aerobic exercise compared to non-aerobic exercise affect hemoglobin A1C within a 3-month period? An etiology question, on the other hand, wants to determine the largest risk factors or causes of a condition or outcome. So again, if we were to compare a population of type 1 diabetics, but this time let's look at smokers versus non-smokers on their lifetime risk for developing lung cancer, our question would be, are type 1 diabetics who have a smoking history compared to those without a smoking history at higher risk for lung cancer over their lifetime. A diagnosis question asks about which test or procedure is more accurate in diagnosing a given condition. For example, if we wanted to know in smokers whether a PET scan or a CT scan was more precise in picking up early lung cancers, we might ask, in smokers, is MRI compared to PET scan more accurate in lung cancer diagnosis? Note that in diagnosis questions, though it may have a time frame specified, this is not common. The prognosis questions look at the likely clinical course over time and/or complications of a condition. In this case, if we were interested in the effect of ambulation versus bed rest on the development of pneumonia in postoperative patients during that first week after surgery, we might form the question, in postoperative patients, how does early ambulation compared to bed rest predict the development of pneumonia over the first week after surgery? Finally, meaning questions seek to understand the implication of an experience in a group of patients. Generally, this does not involve a comparison as we are seeking to understand a single phenomena. For example, how do women with breast cancer perceive their quality of life post-surgery during the first 4 months post-op? The PICO format generates a consistent structure and can be used to create a basis for searching the literature and/or setting up an inquiry. It specifically identifies the population of interest, intervention or issue of interest, comparison of interest, outcome expected, and the time needed. By limiting the question to these key components, it increases the probability of finding the most appropriate evidence in the shortest possible time frame. This has been a brief introduction to forming clinical questions. If you have additional questions, please don't hesitate to contact your instructor.